Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1.
Extract 1. Questions 1 to 12. You hear a vet talking to a pet owner called Toni Davies. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Oh, she's fine overall. I just think it's time I did something about this.
What seems to be the problem?
Well, recently Bubbles has been acting a little bit strangely. When I take her to the park, for example, she'll pick fights with the other dogs just because they're, well, there. She barks so loudly, it's really embarrassing. Then, don't get me started about when she sees any males about. She acts really, well, randy. I've had Bubbles since she was a puppy, so I know when something's up.
Remind me how old she is now?
She's 2.
All right, and what are you suspecting?
I don't know. I was reading around on the internet about what happens to a dog when she's in heat, and she's displaying all the usual signs.
Is Bubbles your only pet?
She is. We were considering another, maybe a German Shepherd or a Dachshund, but I don't know if she'll be able to cope with that.
I understand your concerns.
Will she always be like this? Is there something we can do? It's getting to be a right pain. The neighbors have a pit bull, and the other day I caught him leering at her. He got pretty violent. We've got a huge hole in the fence that I'm pretty sure was down to him trying to bash his way through.
Have you ever considered spaying Bubbles?
What's that?
It's abdominal surgery to prevent her from becoming pregnant. The medical term for it is ovariohysterectomy, when both the ovaries and uterus are removed. She'll have a faint scar on her tummy, but other than that, you won't be able to see anything. She'll be much calmer afterwards, and you won't have to worry about annoying or messy heat cycles.
Oh, goodness, no, I wouldn't want to hurt her. Is there any other way?
Don't worry, it's a relatively painless procedure, and it's all done under anesthetic, and it's over within 2 hours. She'd come in, we'd give you the painkillers for her afterwards, too. Plus, an Elizabethan collar to stop her from interfering with the stitches. There are other health benefits, too.
Really? Like what?
Well, for one thing, it'll reduce her risk of contracting breast cancer or a womb infection, which is something that can be fatal. Plus, pregnancy in dogs can be quite a big risk that can produce medical complications. The list is endless, really. I can only imagine that she creates quite a bit of mess around the house when she's in heat.
You've got that right. All of those months we spent getting her house trained, and now this. Okay, I think it's something that I'd like to do. Like you say, there are lots of health benefits, and I'd like Bubbles to live a long time. Plus, I'm sure you've done this plenty of times before.
Oh, absolutely. It's a common procedure.
It sounds like there are a lot of positives, but what about the drawbacks? Will she change at all?
Her metabolism will likely slow down after she's spayed, so you'll need to feed her less and keep up or gradually increase her exercise routine.
Okay. If you think it would help. How soon could we have this done?
As soon as next week. I'll check to see if we have the space. Just make sure she hasn't had anything to eat beforehand. The food could react with the anesthesia and make her feel nauseous.
Okay. And you say it'll all be done within a couple of hours?
Yes.
What about after the procedure? My partner and the kids have got into a routine with Bubbles now. We each take turns to feed her and walk her. Can we just carry on with our normal routines?
Absolutely. The day after the surgery, she can eat normally. One thing I would say, though, you would need to limit her exercise for about a week after the surgery. I'd also keep her indoors for a little while.
Okay. So we just ease her back into the routine?
Right.
Okay. I'll discuss it with my partner, make sure he's okay with it, and then I can call to book in if that's okay.
That's absolutely fine. Take your time. It's a major decision.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient, Jim Knowles. For questions 13 to 24. Complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Jim. How are you feeling today?
I'm all right, Nina, pet. How are you?
I'm having one of those days, I'm afraid. So let's have a look at your chart. Okay, everything looks good. How are you feeling?
Much better today. I think the morphine has started to kick in.
What are you like? You don't need morphine. Jim, you just need to eat a proper meal. What did you have today?
Don't worry, I did eat my daily ration of slop today. I think they call it a hospital roast.
That was for lunch. What about breakfast?
Yes, I had the usual gruel.
Very good. Your vitals are looking better already. Do you remember much about the fall yesterday?
Yes, I do, pet. I've been getting in and out of my Stairmaster without any problems for the last few weeks. I just had slip and tumble is all. Mavis called the ambulance, though, and here we are.
Okay, it looks as though you've sprained your right elbow. There's a little bit of a bruise forming.
Okay.
I'll make sure you get an ice pack for it. Are you in pain anywhere else?
I don't think so.
And your hearing aid seems to be working just fine. How long have you been using a hearing aid?
Around 5 months now. Right around the same time that I started wearing reading glasses, I think. No, actually, I got it before.
Okay, are you near or far-sighted?
I always thought a little of both. What's the one where you can't read things up close so well?
Ah, okay. Yes, it's confirmed in your notes. Hyperopia, it says.
If you say so.
I do. Would you like your glasses now? I can't see them anywhere.
Mavis took them to get the frame changed. They were broken in the fall.
Okay.
Can I ask you, Nina, why all the interest in my feeding habits?
Mainly because of your medical history, Jim. We want to make sure that you're not malnourished. From your file, I can see you had a bout of dependency on drugs.
I did not. I was an alcoholic briefly, but I haven't touched a drop since '08. I swear.
I believe you, Jim. It's just that your condition means that you're at greater risk of developing malnutrition. We want to keep an eye on you is all. We don't want to lose you.
No, you are too kind.
Will your wife be coming back today with your glasses?
Not just my glasses. She's bringing Callum and Sophie too.
Your grandchildren?
Yes.
You must miss them.
Very much. I can't wait to take them fishing again or to the park. Those are my only hobbies now.
I'm sure they'll be just as excited to see you. Well, if you don't need me for now, I'll go and see if I can find you that ice pack. Try and keep the pressure off your shoulder and arm in general, okay?
Yes, ma'am. Will you come back later to see me before I go to sleep?
Yes, if only to make sure you've had something to eat. You wouldn't want us to get the peg out, would you?
No, that won't be necessary. Just ask them to liven up the menu a little, would you? I don't think I could stomach much more of that slop they call food.
I'll see what I can do. In the meantime, let me fix your pillows. You want to make sure.
That is the end of Part A. Now look at Part B.